हेलो एवरीबॉडी, गुड इवनिंग, नमस्ते। हाउ आर वी डूइंग टुडे? कैसे हैं सब लोग? प्लीज टाइप इट इन द चैट बॉक्स। गुड इवनिंग, गुड इवनिंग। यस, सो दिस इज अ सेशन विच इज ओपन टू ऑल। ये सबके लिए है। वी आर गोइंग टू टॉक अबाउट यूट्रस कैंसर इन जनरल. सो इफ यू नो एनी फीमेल्स और एनी मेल्स who might want this information, जिनको इस बारे में जानकारी चाहिए, गुड आइडिया टू इनवाइट देम ऑल्सो. तो आप ये जो लिंक है ये आप सर्कुलेट कर सकते हैं, आप फॉरवर्ड कर सकते हैं अपने फ्रेंड्स एंड फैमिलीज को, ताकि वो लोग भी ये सेशन ज्वाइन कर पाए. हर हेल्थ मैटर्स हम एक पॉडकास्ट चलाते हैं जो विमेंस हेल्थ के ऊपर डिस्कस करते हैं इश्यूज को. एंड we've already done it once in the last year, and this is the second time we are doing a series of podcasts. So we will be joined by Dr. Prachi. For this month we have already done like two podcasts. We spoke about cervical cancer and we spoke about breast cancer last week. Today we are going to talk about uterus cancer. So, welcome everybody. Welcome to our podcast. And I'm your host. My name is Yamini. I'm also the community manager at Habit. And we are today joined by our esteemed gynecologist, Dr. Prachi. Hello, ma'am.
Hello, good
Hello.
evening, everyone.
Good evening, ma'am. So, ma'am will give us insights about uterus cancer today. So, ma'am, let's jump into the conversation.
Whoever has attended the past two podcasts, so we'll start again with the purpose of podcast. That all of our podcasts are basically focused on creating awareness. That at least all of us should understand the red flag signs when they occur, and immediately approach a healthcare professional, be it your gynecologist, be it your family doctor, but at least you approach a medical professional whenever there is a red flag sign. जिन्होंने भी पिछले दो पॉडकास्ट अटेंड किए हैं, तो हमारा बेसिक जो पर्पस है पॉडकास्ट करने का वो ये है कि आपको ये पता रहे कि आपको डॉक्टर के पास कब जाना है. डॉक्टर ने ये नहीं बोलना चाहिए कि अरे आप 6 महीने पहले क्यों नहीं आए. तो अवेयरनेस क्रिएट करने का बेसिकली हमारा पर्पस वो है. जब हम यूट्रस कैंसर की बात कर रहे हैं तो पहले आप ये समझिए कि यूट्रस क्या है. व्हाट इज यूट्रस व्हेन वी टॉक अबाउट? द
Right.
यूट्रस इज रिप्रोडक्टिव ऑर्गन. Basically, see, it is not alone. Ovaries, uterus, and many other things are working together actually. But uterus is the womb, which we say, which carries your baby. The baby is not
Yeah.
formed there. The baby is formed in the tube, but then it comes and settles into the uterus and grows in the uterus. आपका जो uterus है वो आपकी सादी भाषा में बच्चेदानी कहते हैं, जिसमें आपका बच्चा grow करता है. Her periods, with every cycle, there is a layer of uterus, the inside layer, which forms. If you get pregnant, then it continues. If you don't get pregnant, it breaks down and you bleed as menstrual cycle. So this is what is the uterus, and the inner layer is called the endometrium. So when we talk about menstrual cycle, scientifically जब हम बात करते हैं, तो we always talk in two terms: endometrial part and ovarian part. So today we are going to discuss all about uterus and the endometrium. When we are talking about uterine cancer, let me be very specific. We are talking about endometrial cancer because uterus has three layers. There is the outer layer, which is the serosa, inner layer, which is myometrium or muscular layer, which actually causes fibroids.
Right.
एंड द इनर मोस्ट देयर इज द एंडोमेट्रियम, जैसा मैंने अभी बताया कि जो हर साइकिल में बनती है और टूटती है. So today we are only going to basically discuss, we'll touch fibroids and all as well, but basically we are going to discuss about the innermost layer, which is the endometrium. And today whenever we say uterine cancer, it is synonym with endometrial cancer. We are not talking about myometrium.
Okay, ma'am. So we will take the questions also accordingly. So just ensure that the questions that we ask towards the end of the session. So this will be around 30 minutes of knowledge podcast where we'll have questions which we have prepared for Dr. Prachi, and we will be asking that. After which we will take your questions. So for the next 30 minutes, we would request you to keep your questions to yourself. आप अपने पास रखिए और लास्ट में हम सारे सवालों का जवाब देंगे. तो मैम, जैसे आपने बताया कि हम एंडोमेट्रियम कैंसर की बात कर रहे हैं. सो endometrium is where the implantation happens, right? And that is
Correct.
what makes, I mean, reproduction is what is associated with femininity. So uterus is basically associated with femininity. So if you could just tell us a little bit more about that
See,
connection.
We need to understand that femininity, yeah, basically in today's era, uh, sex is one thing, male, female, and gender is one thing.
Right.
So
Absolutely.
we really need to understand that there is a difference between sexuality and the gender part. Okay, many people associate themselves as transgenders, or males associating as females and all. So yeah, when we talk about femininity, so I'm not even talking about gender, but anyways, femininity is a hormone which is causing all the changes in your body. It is
Right.
not the uterus. Females can be there who don't have uterus. Even that
Right.
can happen. Message करो. So the even that can happen. Okay, so basically feminism, whichever thing we are talking about, even when we talk about your hair growth, your voice changes, breast development and periods and everything are basically related to two hormones, which is estrogen and progesterone. So even the uterus is under the control of these hormones. It's not like the, just one second.
No problem.
So it is not like the uterus is producing those hormones, it is undergoing the action of those hormones. And the hormones are basically being produced by the glands in your brain and in your ovaries. So feminism is actually not related to uterus. Uterus
Got
is just there to carry the baby and to cause menstrual cycles.
it.
So
Agree.
even there can be females with all other characteristics even without having a uterus. So the crucial role is in menstrual cycle and in carrying the baby. But otherwise, the hormone play the major part.
Right. As we also discussed about hysterectomy in the last series of podcasts, so even that you still stay a female,
Female,
right?
right?
Yeah.
Yes.
Exactly. So, ma'am, now that we know about it, we would also like to know how we can take care of our uterus and our overall health, reproductive health.
See, we'll discuss it in key points like 1, 2, 3, 4, like that. We'll start. The most important and most basic is that you maintain your menstrual hygiene. Very,
Absolutely.
very basic. So when we talk about menstrual hygiene, I'll just touch a few points that you know you have to be very alert that you are not missing on changing your pads. If you are using pads, if you are using a menstrual cup, you have to sterilize it before and after every cycle. If you are using tampons, you should every 6 hours bilkul alarm laga ke you have to change it. Like these points are basic menstrual hygiene ke points. When you talk about second point, you have to track your menstrual cycle. Many patients come to us saying that we don't know kab hua tha, we don't remember the dates, and people even don't have an idea that how long their cycles are going on. See, if you don't track your cycle, if you don't keep the changes you'll not be able to find out. Like if the length reduces, if the bleeding increases, whatever the changes are, so you have to keep a track of your menstrual cycle. You cannot just see be off board we don't know what when is going on. Then any menstrual concerns, please directly go to the doctor. इसके साथ तो होता है, मेरी मम्मी मासी के साथ ऐसा होता है, मेरी मामी ने ये बताया है. You let the doctor decide that it is fine. You don't take that call. If you have any menstrual concern which may even include that basically like इस cycle में दर्द ज्यादा हुआ, even that is a concern, that this cycle I had a lot of pain in the periods. So even that kind of concern has to be discussed with the doctor. If you really feel it is concerning, if it is a very minor change, then it's okay. But if you are concerned, let go to the doctor. Then whatever routine visit your gynecologist has advised, and this should start once your periods start. Like you should take your daughters from the age that they attain menses to the gynecologist for routine checkups. A doctor can guide her better, like what changes she should expect. Like maybe the girl is bleeding 10 days and she's not even informing her mother. She
Right.
thinks it is okay. So as soon as the periods start, take the kid to the gynecologist, take your daughters, and let them understand how to take care of themselves, so that even they know ki when they have to report things to their parents. Many people are working parents, you cannot expect them to always know what is going on.
Right.
So the daughter should be able to find and tell कि नहीं इस बार मुझे ये प्रॉब्लम हुई मम्मा, and doctor ने बताया था, you take me there. Apart from that, if you are pregnant, if you are not pregnant, you are in your 30s or in your 40s, whatever regular visits your gynec had advised, please consistently go to follow them. Like, which it may include pap smear, it will include annual breast examination, it will include everything. Okay. So even again, last time we had discussed that annual sonographies also have to be in once a year. So everything, whatever your gynec has prescribed, you follow those routines. After that, as I said, understand the counseling part. Like nowadays, we even get girls of 10 years of age. Like when they have the breast development and when they start getting hairs, their mothers are bringing them for pre-menstrual counseling, a counseling which is
Okay.
done before your period start. Similarly, we have pre-marital counselings. What to expect
Okay.
after marriage, what changes, what concerns, you know, uh, how to, like contraception only. Many patients we come that married since 1 month or 2 months and then they get pregnant and they don't want to keep the pregnancy. And so early abortions are not advised when you don't have a baby. But if you have attended a premarital counseling, you would have taken care of contraception and ye naubat nahi aati.
Right.
So whenever you are getting married, before jumping into the process, you just understand how to prevent pregnancy, how to plan a pregnancy, what efforts to be taken, what precautions, what care. So that is premarital counseling. Then again, there is preconceptional counseling, like when you start planning a pregnancy. Again, consult a doctor. What tests are to be done? I have patients who conceive and then the thyroid is very high or sugar is very high, and we just have to abort for that sake, which could have easily been avoided if they would have attended a preconceptional counseling. So, attend the importance of counseling sessions. We need to understand that a doctor should come into the picture before the disease comes into the picture.
Absolutely.
हमेशा तकलीफ होने के बाद डॉक्टर को याद करने से आपकी तकलीफ बढ़ेगी और कुछ नहीं होगा. So we need to understand these things. Then you have to memorize the red flag signs, जो हम नेक्स्ट इसमें अभी डिस्कस करेंगे थोड़ी देर में. जो भी रेड फ्लैग साइंस हम आपको बताते हैं, हर पॉडकास्ट सेशन में हम ये रेड फ्लैग साइंस डिस्कस करते हैं. ये आपके दिमाग में बिल्कुल जैसे ही ऐसा कुछ हुआ आपकी बत्ती जलनी चाहिए, दैट दिस इज अ रेड फ्लैग साइन एंड आई नीड टू इन्फॉर्म. So shortly, I'll
Perfect.
just touch up again. Maintain
Yes.
menstrual hygiene, track your menstrual cycles, discuss any concerns with your gynecologist. As discussed with your gynecologist, you have to do the follow-up visits. Understand the importance of counseling sessions, which are to be done at particular stages, and then remember the red flag signs.
Absolutely, ma'am. So red flags भी साथ साथ let's discuss what are some red flag signs that you just
बिल्कुल.
mentioned.
जैसे मैंने बोला कि आपको पीरियड का ट्रैक रखना है. सो इफ देर एनी सडन चेंज इन द लेंथ ऑफ द साइकिल और अमाउंट ऑफ ब्लीडिंग, देन यू हैव टू इन्फॉर्म इमीडिएटली. अच्छा, 2-3 दिन इज ओके इधर उधर, बट सडनली योर पीरियड्स आर 10 days लेट और 10 days अर्ली. यहाँ पे हमने बहुत बार डिस्कस किया है मैजिक नंबर 21 days and 35 days. So it should not be earlier than 21 and greater than 35 days, the length of the cycle. And the bleeding pattern. Usually, if you bleed for 3 days, suddenly you are bleeding 7 days. Usually, you change 3 pads a day, suddenly you are changing 8 pads a day, or vice versa. That you are bleeding only a day, or you don't even need to change one pad in one day. Both the things are changes in the cycle and need to be discussed with the doctor. So, that is one red flag sign. Any sudden major change in the cycle. Then second part is severe pain during menstruation. Even if it is the onset, बहुत लोगों का रहता है कि हमें तो हमेशा ही होता है. इवन इफ यू हैव इट कि आपको हमेशा होता है, बट यू हैव नेवर डन अ सोनोग्राफी, यू हैव नेवर मेट अ गायनेकोलॉजिस्ट, see the gynec once, let them do the sonography and the test, so that nothing is being missed. Fibroids can cause severe pain, endometriosis can cause severe pain, PID is so easily treatable. 1 महीने का course and your pain goes away like anything. But if you consider it normal, then there is no way to treat it. Let the
Absolutely.
doctor say this pain is normal and you have to just take painkillers and go through them. So, any severe pain during menstruation, then you have to meet the doctor. Similarly, severe pain during intercourse is also a red flag sign. Mild discomfort can be there, but I'm using the word severe. बहुत ज़्यादा अगर pain है, whether it is during periods or during intercourse, it is not okay. If you are planning your pregnancy before 25 and after 35, it's not
Okay.
okay. It is not okay. Okay. So या तो आप प्लान मत करिए, या अगर आप कर रहे हैं तो then you are a high risk pregnancy. At least take proper guidance कि how to take care of yourself. दिस हैपन्स यूजुअली अर्ली प्रेगनेंसीज में ज़्यादा दिक्कत जाती है, बट इवन 35 वालों को मैंने देखा है, 37-38 ईयर एज है और 3 मंथ्स बाद हम आ रहे हैं, स्कैन्स मिस हो गए हैं, सो देन दैट इज नॉट गुड. सो इफ यू आर प्लानिंग अ प्रेगनेंसी, एक्चुअली तो कोई भी प्रेगनेंसी में, एज आई सेड, कि आप प्रेगनेंसी के पहले काउंसलिंग करिए एंड इमीडिएट चेकअप्स करिए, बट if you are planning a pregnancy before 20 and after 35, it is not okay. Okay. Any bleeding between the periods, like you have, ये हमने सर्वाइकल कैंसर में भी डिस्कस किया था, जिन्होंने अटेंड किया होगा उनको याद होगा कि इंटरमेंस्ट्रुअल स्पॉटिंग या इंटरमेंस्ट्रुअल ब्लीडिंग, आपके पीरियड खत्म हो गए हैं, नेक्स्ट पीरियड आने में टाइम है, बीच में सडनली 1-2 दिन आपको ब्लीडिंग या स्पॉटिंग हो रही है, तो इट इज नॉट गुड. एंड देन अगेन पोस्ट कॉइटल ब्लीडिंग, ये भी हमने सर्वाइकल कैंसर में डिस्कस किया था कि इंटरकोर्स के बाद अगर आपको स्पॉटिंग या ब्लीडिंग हो रही है तो इवन दैट इज अ रेड फ्लैग साइन. Now, when we talk about uterine cancer, it is more common in elderly patients. Again, we don't usually see in young patients. Cervical cancer can be seen in young patients, but uterine cancer, age is the most important risk factor. So, and that is why the most high risk red flag sign is post menopausal bleeding. हमारे पिछले ईयर के जो पॉडकास्ट थे उसमें हमने ये बताया था कि अगर आपके घर में आपके मदर इन लॉ किसी को भी एक बार पीरियड्स बंद हो गए हैं एंड सडनली उसके बाद अगर कभी भी स्पॉटिंग या ब्लीडिंग हो रही है, तो दैट हैज टू बी कंसिडर्ड एज यूट्राइन कैंसर अंटिल अनलेस प्रूवन अदरवाइज. इतना रिस्की है वो. सो मेनोपॉज आने के बाद में ना स्पॉटिंग होनी चाहिए ना ब्लीडिंग होनी चाहिए. ऐसा नहीं है कि दैट इज कैंसर ओनली, लेकिन इट इज अ हाई चांस दैट इट कैन बी कैंसर.
ऐसा मैम
Then
हमें
we
बहुत
talk about,
कॉमेंट भी आया था कि आई थॉट आई अचीव माय मेनोपॉज, आई स्टॉप ब्लीडिंग, देन आफ्टर 6 months once I had a massive bleeding. तो that
यहाँ हम
time
ये भी
also.
समझेंगे कि मेनोपॉज की डेफिनेशन के लिए आपको मिनिमम 1 ईयर तक पीरियड नहीं आना चाहिए. ओके, वंस इट हैज बीन 1 ईयर दैट यू हैव नॉट गॉट योर मेंसेस, and ideally again the diagnosis has to be confirmed by a blood test which is done by the doctor, and then we say that yes, you have attained menopause.
Right ma'am.
देन टॉकिंग अबाउट, ये हमने सर्वाइकल कैंसर में डिस्कस किया था, सीवियर एब्डोमिनल पेन या बैक पेन है तो इट कैन बी एंडोमेट्रियल कैंसर. ठीक है, जरूरी नहीं है, बट बहुत बार ये होता है कि हम ऑर्थो साइड में सोच रहे हैं कि हड्डी का प्रॉब्लम है, निकलता कुछ और है. एंड अगर आपको फ्रीक्वेंट एबॉर्शंस या मल्टीपल प्रेगनेंसीज की हिस्ट्री है तो आप हाई रिस्क में आते हैं. सो दैट मीन्स कि आपका फॉलो अप ज्यादा फ्रीक्वेंट होना चाहिए. ठीक है, मोर देन 3 अबॉर्शंस या मोर देन 3 प्रेगनेंसीज को हम मल्टीपल काउंट करते हैं. इसके अलावा अगेन ऑलमोस्ट सर्वाइकल कैंसर यूट्राइन कैंसर के रेड फ्लैग साइन सिमिलर हैं, तो एनी नोटिसेबल डिफरेंस इन वजाइनल डिस्चार्ज इज अगेन अ रेड फ्लैग साइन.
All right, ma'am. So these are the 8 signs that we just discussed. Quickly, I'll repeat them. Sudden changes in period length or volume, severe pain during either menstruation or intercourse, pregnancy before 25 or after 35, bleeding between periods or after intercourse, bleeding,
Yes,
yeah, if yeah, inter cycle, right?
intermenstrual, yes.
Postmenopausal bleeding, abdominal pain or back pain, history of multiple abortions or pregnancies, and any change in vaginal discharge or odor. Yes, ma'am. So, ma'am, फिर अगर सपोज कुछ होता है, what are the screening procedure? क्या आप recommend करेंगे as next steps if some red flags are observed after?
आइडियली एज वी सेड, जैसे पैप्समियर हमारा सर्वाइकल कैंसर की स्क्रीनिंग है, वैसे ही साल में एक बार ट्रांस वेजाइनल सोनोग्राफी करानी चाहिए. whenever you are going for a sonography, and when we are talking about uterus, abdominal sonography is not recommended. The sonography has to be through the vagina. Obviously, for patients who are married and have babies, patients who are not sexually active, we cannot do. But patients who are sexually active, have babies, are married, the sonography has to be transvaginal. Otherwise, many things are missed. So, as I always say, ki after the age of 30, once a year you should do a sonography. Anyways, complete abdominal sonography should be done, which should include liver, kidney, ovaries, everything. But when we talk about gynec point of view, it has to be an annual transvaginal sonography once
We
in a
will
year.
We'll write this name in the and we'll pin it on YouTube so that you have this ready for whenever you want to refer. Yes, ma'am. Please
So
continue.
the recommendation is actually not for everyone, but I believe that in the era we are living, I recommend that all of us once a year we should do. But patients who are high risk, like who have history of family of breast cancer, ovarian cancer, endometrial cancer, any female oriented cancer history is there, and other risk factors we are going to tell in detail now. So if you fall in the high risk category, then at least please do it.
Or what are the other conditions? Are there certain ages like after which, like you said, marriage or
Maybe I am saying after 30, but at least after 35. Because
okay,
at least 35 तक भी you are healthy, your metabolism is good, you're not aging. 35 के बाद तो sudden aging start हो जाती
ठीक है. So if you're above 35, our doctor recommends that you get transvaginal sonography done once a year so that, and if you know that somebody in your family has undergone any form of cancer and certain risks are involved genetically, so it's a good idea to just take precautions accordingly. So ma'am, what are the high risk factors for endometrial uterine cancer?
है. See, as I said कि uterine cancer is a cancer we usually see in old age. So the most important risk factor itself is advancing age. 45,
Okay.
50, 55. I have till date not seen a cancer less than 40-year-old uterine cancer. I have not seen. It's not that it cannot occur, but it's not common. Commonly, it occurs at after 50s actually. It is more common after 50 years of age. So advancing age itself is a very big risk factor. Then for you, endometrial cancer, obesity is very, very, very important. If you are very obese for long durations and advancing age, मतलब 50 प्लस हैं आप और आपका BMI भी ज्यादा है, तो ये दो आपके बहुत बड़े रिस्क फैक्टर्स में काउंट होते हैं फिर. ओके. देन थर्ड इज आपका मेंस्ट्रुअल साइकिल कितना लंबा रहा, मतलब नॉट दैट एवरी मंथ वाला साइकिल. व्हेन डिड यू अटेंड मेनार्की, आपका पीरियड कब स्टार्ट हुआ, एंड व्हेन डिड यू अटेंड मेनोपॉज, आपका पीरियड कब खत्म हुआ. सो
Hmm.
जिनको जल्दी पीरियड आता है, अर्ली ऑनसेट ऑफ मेंस्ट्रुएशन, एंड देर से जाता है, डिलेड मेनोपॉज, they are at higher risk because your endometrium is going under that number of cycles, extra cycles. So you are at higher risk. Then hormone replacement therapy with estrogen alone. ये मैंने breast cancer में भी बताया था कि estrogen plus progesterone वाली hormone replacement therapy safe रहती है. आजकल तो कोई नहीं देता, but अगर आप सिर्फ estrogen replacement ले रहे हैं for any reason, तो you are at high risk. अपार्ट फ्रॉम दैट, ओबेसिटी के साथ में अगर आप डायबिटिक हैं तो अगेन आपका रिस्क बहुत ज़्यादा बढ़ जाता है. So type 2 diabetes mellitus is also a risk factor. And if you are taking diet which is very high in animal fats, and very high means very high, not mild wala, so then again it is a risk factor.
Okay, so with these risk factors, it is advisable to be extra cautious, consult with the gynecologist more frequently, so that necessary steps can be taken at the right time and prevention can be done. So, ma'am, how is it diagnosed? How is uterus cancer diagnosed?
Initially, the first step is a sonography only. And usually, the inner layer, the sonography report will say inner layer is thickened. लाइक जितना
Okay.
उसकी ये होनी चाहिए थिकनेस उससे ज्यादा है सोनोग्राफी पे. एंड देन आइदर अ डीएनसी इज डन, लाइक क्यूरेटाज जिसको बोलते हैं, या सादी भाषा में धुलाई बोलते हैं, तो जिसमें कि पेशेंट को बेहोश करके और अंदर का पूरा टिश्यू निकाल के चेक करने के लिए भेजा जाता है. बट आजकल एक ओपीडी प्रोसीजर भी आया है जिसमें एक पिपेट यूज करते हैं हम, बहुत बारीक सा एक प्लास्टिक का कैनुला होता है, एंड विद दैट वी टेक द सैंपल एंड सेंड फॉर बायोप्सी. बायोप्सी के बिना तो डायग्नोसिस कंफर्म नहीं हो सकती. सोनोग्राफी गिव्स एन आइडिया, बट सोनोग्राफी कंबाइंड विद द कंप्लेंट्स, लाइक क्लिनिकल डायग्नोसिस जिसको हम बोलते हैं, कि आपकी कंप्लेंट्स के बेस पे हम एक डिसीजन लेते हैं कि आपका चांस कितना है कैंसर डायग्नोस होने का. प्लस सोनोग्राफी हमको हेल्प करता है. उसके साथ में फिर अगर हमको लगता है तो देन वी मेक द डिसीजन ऑफ अ डीएनसी. यहाँ पे मैं एक बहुत जरूरी बात समझाना चाहूंगी आप सभी को. एनीबडी हु इज एज 50 से ज्यादा है, आपको ब्लीडिंग प्रॉब्लम है और अगर डीएनसी प्लान कर रहे हैं, प्लीज डू नॉट अंडरगो अ प्लेन डीएनसी, अंडरगो अ हिस्ट्रोस्कोपिक डीएनसी. व्हाट इज अ हिस्ट्रोस्कोपिक डीएनसी? एक कैमरा इंसर्ट किया जाता है वेजाइना के थ्रू यूट्रस में, एंड पूरी अंदर की कैविटी को पहले ऑब्जर्व किया जाता है. व्हाई इट मेक्स अ डिफरेंस, आई विल एक्सप्लेन. जो नॉर्मल डीएनसी होती है, इट इज अ ब्लाइंड प्रोसीजर, हमको कुछ दिखता नहीं है अंदर का, वी जस्ट यूज एन इंस्ट्रूमेंट टू टेक आउट द टिश्यूज. But when we do a hysteroscopic biopsy, we first inspect the whole uterus from inside. And from after that, जहां हमको सस्पिशन लगता है वहां से बायोप्सी ली जाती है. सो इसमें अर्ली कैंसर मिस का रिस्क खत्म हो जाता है. I'll just explain. Give me 1 second.
You have a diagram that you want to pull out?
I have these things now. Like हमने
Oh, wow.
breast में use. So this is
I'll just
how
put
your.
you on spotlight completely for 2 minutes.
Yes, yes, yes. So when we talk about the vagina, no, so this is your vagina, okay. So जब हम routine procedure करते हैं, जब जो सादा DNC जिसको हम बोलते हैं, so what we are doing is we are taking the instrument, we are going inside, and we are just doing like this. मुझे अंदर का कुछ भी नहीं दिख रहा है. But when we are doing a hysteroscopic DNC, in a hysteroscopic DNC, this has a camera. तो ये कैमरा अंदर जाता है. Sorry, yeah, the camera goes inside. We inspect the whole. पूरा पहले हम अंदर ढूंढते हैं. अब फॉर एग्जाम्पल कि अंदर जाने के बाद मुझे पता चल रहा है कि यहाँ पे टिश्यू है, और हो सकता है कि नॉर्मल जब मैं बिना देखे कर रही हूँ तो वो टिश्यू मिस हो जाएगा. बट व्हेन वी सी विथ कैमरा, वी फर्स्ट सी कि कहाँ हमको ऐसा दिख रहा है कि दिस कैन बी कैंसर, एंड देन द बायोप्सी इज टेकन फ्रॉम दैट पॉइंट. सो दैट मेक्स अ ह्यूज डिफरेंस. This is a fibroids so diagram, but again I will show. यहाँ से कैमरा अंदर जाता है and we see कि अंदर क्या है, and then the biopsy is taken. So it makes a huge difference, especially for early diagnosis. Yamini, we can come back.
Yes, ma'am. That was very, very insightful, actually. And so D and C, not D and C, but D and C is the procedure. So if you go for a process which gets the doctor better insights and is able to guide you better, would be better for our health, our early protection, prevention, and even maybe it'll just help you out in general.
This we
So,
can put in the comments, Yamini,
yes,
that if
ma'am.
the DNC is being done from the point of view that they want to rule out cancer, then it has to be a hysteroscopic DNC, and never settle for a routine DNC.
Yes, ma'am. We'll add this also to the comment along with the tests above.
Yes.
So, मैम आपने कहा था हम थोड़ा सा फाइब्रॉइड्स भी डिस्कस करेंगे. डू यू वांट टू डू
Yes,
इट? एंड
that's why I had this with me. कि अब आप ये वाले डायग्राम को बहुत अच्छे से
मैम आई एम
देखेंगे.
जस्ट एडिंग यू बैक फुल स्क्रीन, ओके, फॉर अ मिनट.
ये वाले डायग्राम को आप लोग सब लोग अच्छे से देखेंगे. आई वांट टू पॉइंट आउट, ये जो बड़े बड़े आपको दिख रहे हैं ना, दीज थिंग्स आर द फाइब्रॉइड्स. सो अगेन वील अंडरस्टैंड द स्ट्रक्चर ऑफ द यूट्रस. ये जो इनर पार्ट है जहां मेरी पेंसिल एंटर हो रही है, दिस इज द एंडोमेट्रियम, एंड यहीं पे आपका बेबी रहता है. ये जो पार्ट है, दिस इज द मस्कुलर लेयर, एंड मस्कुलर लेयर इज नोन एज मायोमेट्रियम. सो मायोमेट्रियम में जब ग्रोथ आती है उसको हम फाइब्रॉइड्स बोलते हैं. ओके, सो फाइब्रॉइड्स आर यूजुअली बेनाइन. फाइब्रॉइड का कैंसर बहुत ज्यादा रेयर है. सो बेनाइन ग्रोथ्स रहती हैं. इट कैन बी आउटसाइड, मतलब ये ग्रोथ बाहर की तरफ जा रही है, एक ग्रोथ अंदर की, भले ये अंदर आ रही है बट इट इज अ पार्ट ऑफ द मायोमेट्रियम, ये एंडोमेट्रियम का पार्ट नहीं है. और ये जो मायोमेट्रियम के अंदर ही रह जाती हैं, ये भी फाइब्रॉइड्स हैं. फाइब्रॉइड्स का कोई कॉज नहीं है एज सच नोन कि मैं आपको बोलूं कि जैसे हम प्रिवेंशन के लिए बताते हैं कि आप ये नहीं करेंगे तो प्रिवेंट हो जाएगा, ऐसा कुछ भी नहीं है. ऑल यू कैन डू इज कि अगर आपको हेवी ब्लीडिंग हो रही है या आपको बहुत सीवियर पेन हो रहा है, तो आप दिमाग में एक रखिए कि इट कैन बी फाइब्रॉइड. नाउ फाइब्रॉइड्स आर मोर कॉमन इन यंगर एज ग्रुप, स्पेशली कॉजिंग प्रॉब्लम. ओल्डर एज में होगा भी तो वो प्रॉब्लम नहीं कॉज करेगा. तो फाइब्रॉइड्स में आप ये ध्यान रखिए कि यंगर एज ग्रुप में जब हेवी ब्लीडिंग और पेन हो रहा है तो मोर लाइकली फाइब्रॉइड है. एल्डर एज ग्रुप में जब हेवी ब्लीडिंग हो रही है तो मोर लाइकली कैंसर है. एंड कैंसर इज यूजुअली नॉट पेनफुल, इट्स जस्ट हेवी ब्लीडिंग.
All right, ma'am. So that is it in terms of podcast, ma'am. If you remember any other points that we want to discuss, or else we can take some questions.
I think basically we have covered everything ki. So again I'll say the point of podcast is awareness. So आप अगर सिर्फ अपने हाई रिस्क फैक्टर्स याद रखें, रेड फ्लैग साइंस याद रखें, और रूटीन केयर कैसे करनी है इतना याद रखें. अगर आप इतना भी टेक होम मैसेज लेके जा रहे हैं तो आई विल फील कि द पॉडकास्ट इज सक्सेसफुल.
Absolutely, ma'am. थोड़े questions लेते हैं. If you
Yes,
think,
yes. We can start. Yes.
yeah, some questions are related to fibroid and all, because I can't see a lot of. क्वेश्चंस, मतलब बहुत ऐसे पर्सनल क्वेश्चंस जो है आई। सो मैम एक है एंडोमेट्रियम थिकनेस, endometrium thickened by 17 millimeter, biopsy came negative, gynecologist suggested Marina.
Marina is a very good idea. Should go ahead with it. Once the biopsy is negative, you can definitely go ahead with Marina. Marina is wonderful.
Any blood test to, ma'am, you mentioned blood test for menopause stage, right? What is
Yes,
the name
yes.
of that
It
blood
is
test?
it is serum FCH, follicle stimulating hormone. I think I can put in the private chat and she'll guide you.
Yes. We will add this on the comment, ma'am.
When this is high, that means that you are either you have attained menopause, you are going to attain. Because ऐसा नहीं होना चाहिए कि just because periods are not coming, you are thinking it is menopause, and it can be many other things. I recently delivered a patient, 45-year-old. She came to me at 6 months saying that I am feeling some movement inside. I have been gaining weight. She thought she has attained menopause, but she was pregnant
Oh,
at 45. So you have to be alert that ways.
ma'am, what is DNC?
The full form is dilatation and curettage. So what we do is basically this is usually closed when we are talking about this opening is not as such. ये तो वेजाइना की ओपनिंग ओपन रहती है बट अंदर सर्विक्स जो है सर्विक्स क्लोज्ड रहता है. So that is why the first term is dilatation, that we have to insert a dilator and we have to open the cervix. Okay, and then curettage means that we clean it. Like अंदर से हम ऐसे खुरच खुरच के टिश्यू निकालते हैं. So that is the meaning of curettage. So dilatation and curettage. That is the procedure is DNC.
I am diagnosed with bulky uterus, but no other signs. Periods are
Bulky
regular.
uterus.
I
बल्कि
am
यूट्रस
40.
को आप कभी कंसिडर ही नहीं करिए.
मैम आप भी एक बार कमेंट्स चेक कर लीजिए इफ यू थिंक
Yeah,
देयर आर एनी
sure.
अदर.
Too many
I
are.
have
I'll
gone
just
through yes, ma'am. I have gone through hysterectomy and oophorectomy, so still I need to go for pap smear test.
sorry. Hysterectomy and oophorectomy. Yeah,
Yes.
pap smear can be done for vault. ये हमने डिस्कस किया था सर्वाइकल कैंसर में कि वॉल्ट कैंसर के लिए आप पैप स्मीयर कर सकते हैं. सो आई हैव मैंने थोड़ा ऊपर से स्टार्ट किया है. सो वन ऑफ द क्वेश्चन वाज दैट आफ्टर सिजेरियन दे हैव हेवी ब्लीडिंग एंड क्रैम्प्स and so ultrasound is normal. See, the only thing which is missed on ultrasound is endometriosis, and cesarean section can cause endometriosis. आप अपने गायनेक से डिस्कस करिए कि if it is endometriosis, then they can at least give you a trial treatment of endometriosis also works, because the confirmed diagnosis of endometriosis is only through a laparoscopy. तो वो करने का मतलब नहीं है. What we do is we give you a trial treatment of endometriosis and sometimes it works for Toshi somebody. Okay, so next, Mirena is a special type of copper which has a progesterone hormone in it. So आपको orally दवाई नहीं खानी है, आपके यूट्रस पे लोकल ही दवाई काम कर रही है, which is wonderful because it has no side effects. Okay,
And
permanent pain in
also it
tailbone.
prevents your timing, right? You have to have it at a certain time.
See, so many, मतलब you don't have to think about it, na? It's there, it's working on its own. You don't have to apply brain only.
Yeah.
So, permanent pain in tailbone can be many things. पहले आप orthopedician से मिलिए. If they say everything is normal, then you can consult a gynecologist. Chocolate cyst is endometriosis. Yamini, I think we have to do a separate podcast on endometriosis.
Yes, ma'am. We will note this and we will take this up.
Actually, the podcast should be on pain, and then in pain we can cover fibroids and PID and endometriosis and all benign things. Like all these three were cancer based. अब हम नॉन कैंसर वाले कवर करेंगे नेक्स्ट सेशन.
ठीक है मैम. Next, ma'am, brown discharge after and before periods, is it okay or not
एक या
safe?
1 or 2 days is fine, nothing to worry. Severe back pain during periods is usually endometriosis. आप प्लीज डॉक्टर से कंसल्ट करिए. हेवी ब्लीडिंग कॉमन इन 19-year-old फॉर फर्स्ट 2 days. आपकी हेवी ब्लीडिंग और मेरी हेवी ब्लीडिंग की डेफिनेशन कैन बी डिफरेंट. कंसल्ट अ गायनेकोलॉजिस्ट. 70-year-old वेजाइना इज गोइंग टू बी ड्राई. एट्रोफिक वेजाइनाइटिस बोलते हैं. ईस्ट्रोजन की क्रीम्स आती हैं, आप अपने गायनेक से कंसल्ट कर सकते हैं. ओके, After removal of uterus and ovary, again still once a year checkup करना है, सबको करना है. Okay. यूरिनरी लीकेज गायनेकोलॉजिस्ट के पास मत जाइए, यूरोलॉजिस्ट के पास जाइए. दे कैन गिव यू अ वंडरफुल ट्रीटमेंट. ट्रीटमेंट भी है, सर्जरीज भी हैं, बट गायनेकोलॉजिस्ट इज नॉट द पर्सन. कंसल्ट अ यूरोलॉजिस्ट. ओके. ओके.
Ma'am, can I take a question?
या प्लीज प्लीज.
What happens to the egg if not fertilized? Does it also shed with the lining?
No, it dies away and gets absorbed in the body itself.
I am 61. I fall in the red flag category, but not complaints so far. I consult Gynac once in 2 years and take all necessary tests. Any other precaution should I take?
No, just make it once in a year is what I will recommend.
Mhm.
और तो कुछ ऐसा मुझे दिख नहीं रहा. I mean, if you can find a very मतलब
I'm also doing
fibroids question है.
relevant
Fibroids.
सेशन करते हैं
हाँ,
अगर
मैं वही कह रही हूँ. Fibroids, adenomyosis, PID and all ना, we have to take a separate session.
yes ma'am, let's take all those questions there. Endometrial storage sarcoma, is that detected early?
All endometrial carcinomas can, मतलब हिंट तो हमको सोनोग्राफी पे मिल ही जाती है. सोनोग्राफी इज अ वेरी गुड टूल. मतलब इफ यू आस्क मी फॉर एंडोमेट्रियल कैंसर, एमआरआई से बेटर सोनोग्राफी है. If it is being done transvaginally, not abdominal sonography, that's sonography which is done through vagina, and if a very good doctor is doing it, then it is wonderful for endometrial cancer, any type, even sarcomas.
Sonography even after menopause, ma'am?
Yes, it is. Uterine cancer happens after menopause. As I said, it is more common after 50 years of age. तो बिल्कुल करना ही है. Until unless hysterectomy done है तो फिर जरूरत नहीं है. But your uterus is there, then you have to do it. It is more common after menopause only, uterine cancer.
Ma'am, I can actually see more questions which are not
Related to this.
yes. Is it
Yes, even I.
okay? Yeah, is it okay to have intercourse even if there is cancer?
Yes, but you have been taking cancer का treatment, तो intercourse से actually कोई relation नहीं है. But अगर आपको heavy bleeding है, बाहर growth है, then it is a problem. So this is again a question depending on staging and many other things.
Right. Ma'am, I do not know what LNG is, so I'll just read the question. If you think it is relevant, then. I had heavy bleeding, so LNG is inserted. Am I at a risk of getting cancer?
No, LNG is Mirena only, Yamini.
Okay.
Mirena and LNG are same thing. And no,
Okay.
Mirena doesn't increase the chances of cancer.
Yes.
Please rest assured.
I
I
think,
think
ma'am, yeah,
yes.
most questions are covered. We will, that is the end for this month's podcast. We will just try to check with your schedule and our schedule if we can arrange for one more session in
Yes,
the month of
ovarian cancer is pending
yeah.
with us.
Ovarian cancer is pending, and also, like you mentioned, pain. That
Yes,
session is also pending. So then we will try and schedule two,
true.
and
Yes.
we will do, or maybe, ma'am, we what we can do is we can think of more topics which are related, and then do another 4 month, four
I love
sessions.
to. I love to.
Thank you so much, ma'am, for taking time out again and doing series 2 of HHM podcast. We're very grateful for your support and how you explain things with such ease and familiarity that it does not feel कि कुछ तो एक डॉक्टर बोल रहे हैं जो ऐसे उड़ के चला जा रहा है. Thank you so much. And this time you also got a lot of props to help analyze better. So hope that was also very helpful for all our members. I hope आप लोगों को समझने में थोड़ा आसान हुआ with diagrams and जब सामने आपके objects हो तो understanding बहुत improve हो जाती है. So thank you so much, ma'am. Really, really grateful. We look forward to having you again on the next series of
Same.
Her Health Matters. Thanks, ma'am. Good night,
Take
ma'am.
care. Good night.
So that's it for Her Health Matters. We will see you for okay, and a very very happy happy anniversary to all of us. Missed congratulating, very very special day for us because Yeah, completed 4 years today. So thank you all for being a part of this journey and taking habit to the heights that it is. आप लोगों की वजह से है जो है. So amazing, so good to see all of you, and thank you so much for joining us today on this very, very special edition of Her Health Matters. We hope that you learn something from this Her Health Matters, and आप अपने जीवन में जो अर्ली प्रिवेंशन टेक्निक्स हैं, जो साइंस है, जो टेस्ट है, हम लोग उससे अवेयर होकर वो रेगुलरली करवाए, ताकि हम अपने और अपने प्रियजनों, अस एंड आवर लव्ड वंस, वी कैन all be protected. So let's do the takeaways that we discussed. Also, I'll add the tests which are mentioned on the YouTube chat section. We will pin it tomorrow around 12 noon, so that you can always refer to it. आप जब भी चाहे आप refer कर सकते हैं. That's it for today. If you have any more questions, please reach out to the support team. They will help you with it. A very good night and take care. We will see you tomorrow. Bye bye.